Good evening, everyone. On behalf of the American Chronic Pain Association, the ACPA, and Penny Cowan, the founder of the ACPA, I welcome you to the first of an ACPA webinar series. Tonight's topic is living with pain in the midst of a pandemic, the impact of COVID-19, presented by tonight's speaker, Dr. Ravi Prasad, PhD. Dr. Prasad is a psychologist in training and currently clinical professor and director of behavioral health in the Department of Anesthesiology and Pain Medicine at the University of California, Davis School of Medicine. His clinical work focuses primarily on evaluation and treatment of individuals suffering with both acute and chronic pain conditions. He's actively engaged in leadership activities at regional and national levels, through which he's been involved with interprofessional core competency, curriculum, and program development. Also lobbying efforts to change policies related to psychological care and translation of research innovations into actual clinical practice. Outside the realm of pain, he has an avid interest in clinician wellness and has led efforts to implement associated initiatives in healthcare settings. It is my extreme pleasure to welcome Dr. Prasad, and go for it, Doc. Cheering you on.
All right. Well, thank you very much. I'm going to share my screen here. So bear with me for a second while I get this up. All right. Is the screen up there now?
Yes, sir, it is.
Okay. Well, thank you very much for that introduction, Tom, and thank you for having me here today. As you mentioned, my name is Ravi Prasad. I'm a psychologist at University of California, Davis School of Medicine, and I'll be speaking with you all tonight about living with pain in the midst of a pandemic, specifically the impact of COVID-19. Now, I want to start tonight by expressing gratitude to two people who are very important. First, Penny Cowan, who you all know is the CEO and the founder of the American Chronic Pain Association. Penny has worked tirelessly over the last 4 decades plus to advocate and to educate and speak for people who are living with pain. And she has done a tremendous amount of work in this area. And I'm always impressed and amazed by just how much she does. And I question where she gets her energy from, because it seems to be a never-ending supply. And then also Lieutenant Colonel Tom Norris, who's basically put all this together tonight. Lieutenant Colonel Norris has been with the American Chronic Pain Association for over 20 years. And I've had the pleasure of being able to work with both of these individuals on another project over the course of the year. And it's been just an absolute delight to work with them. One of the things that American Chronic Pain says, one of their bylines, is that they offer help and hope for people living with pain. And I would say that Penny and Tom, both of you offer help and hope for people living with pain. So thank you both for all that you do. So we'll go on and start with the talk itself today. So all of you who are on the line tonight certainly appreciate that learning how to live with a pain condition requires a fine balancing act, in that the process of pain management involves multiple pieces. The overriding goal of learning how to live with pain involves trying to maximize our functioning, and that means all of our day-to-day activities, from the exciting things such as having social interactions with friends and family, to the more mundane things that we just have to do in life, like our chores, things along those lines. We want to minimize the emotional distress. When we're living with a pain condition, it naturally takes a toll on us. We can have emotions such as depression, anxiety, anger, frustration, and not necessarily as a clinical diagnosis, but just as we define these words in the dictionary. It takes a natural toll on us as human beings. But we want to minimize this emotional distress. And ultimately, by maximizing functioning and minimizing emotional distress, what we're really endeavoring to do is to optimize quality of life. And so again, it really is a true balancing act. But many times when people hear folks talk about learning how to live with pain, it can be a perplexing concept. Well, what do you mean learn to live with pain? Sometimes people hear that and they think, is that just a nice way of saying, suck it up and deal with it? And the reality is it's not. And one of the ways that I like to conceptualize this that I think might make sense to many of you who are watching today is using this diagram here. Let's say that this square represents your life. If somebody were to ask you about your life, let's say that you go to a family reunion, you sit next to somebody who you haven't seen in many, many, many years, or somebody who you've never seen before, who's a family member, distant family member. Somebody asks you about your life. What are the things that you talk about? Well, oftentimes people talk about their family. They talk about their friends. They talk about school, leisure activities, sports. They may talk about their vacations, neat restaurants that they've been to, hobbies that they have, entertainment venues that they've been to. And then also, again, some of those different mundane things that make up all of our lives, but cooking, cleaning, errands, these are all the simple things that typically make up our lives. And these are the things that give our lives meaning. One day, a pain condition sets in, and that pain condition naturally takes center stage. It's something new, it's something foreign to us, and we spend a lot of time trying to understand what it is, understand the cause, try to treat it as best we can to make it go away. Naturally and understandably, that pain does take center stage, and it's right there in the middle, but we still have space for all those other things that give us meaning. We can still interact with friends, family, engage in some of those self-care activities. But over the course of time, as the pain fails to respond to initial treatments, or as it transitions from that acute to more of a chronic state, what starts to happen is its impact starts to become more pronounced. Our activity levels start to decrease. We're not able to go to work on a consistent basis anymore, or we're not able to work at all. Our ability to engage in some of those different leisure activities, going out to eat with friends, going to family activities, our ability to do these things starts to become diminished. And so we start to pull away from activities. As we start to pull away from these activities that give us meaning, we may start to have increased emotional distress. And again, this is some of that depression, anxiety, frustration. And again, not as a clinical diagnosis, but as we define it in the dictionary, or it may come on as in a clinical format. Sleep disturbances can start to present themselves, where we may have difficulty falling asleep, difficulty staying asleep, or difficulty getting a restful night's sleep. And those sleep difficulties may be because of the pain. It could be because of the emotional distress we're experiencing because of the pain. It may be for the treatment that we're receiving for the pain or the emotional distress, or from a combination of all of those. There's oftentimes increased number of doctor office visits where, it's not uncommon for me to hear many patients tell me that the most significant social or human interaction that they have in their lives is when they come into the clinic and see people. But oftentimes social interactions have been replaced, regular social activities have been replaced with doctor office visits. And naturally, it's expected that interpersonal problems may start to develop. As we pull away from those activities that give us meaning, as we're not engaging as much with family and friends, conflict may start to evolve in those different relationships. And then lastly, our bodies can start to become deconditioned. As we use our bodies less and less, or as we use the parts of our body affected by pain less, we can start to have atrophy of the muscles. We can start to become deconditioned. And that process, unfortunately, actually worsens the pain condition over the course of time. But what we see is that this pain started off as something that was centralized, but we still had space for all these other pieces that gave us meaning in our life. But over the course of time, it radiated out and it overshadowed all those things that gave us meaning, where we no longer have space for those things. And so now, oftentimes, if you ask somebody who's been living with pain for a period of time about their lives, oftentimes you may not hear them talk about family, friends, work, school, leisure activities, but you may hear people talk about the impact of their pain. You may hear people talk about a new physician they're going to see, a new procedure they're going to try. Even if a person says, no, you know what, that's not me. I don't talk about that with anybody. That may still be what populates the mind, where that's what we first go to, where we're no longer telling the story of our lives and what give us meaning, but we're starting to tell the story of the pain's life. So one of the things that's very important that American Chronic Pain Association tries to advocate for, and one of the things that I'm sure that many of you have exemplified over the course of time, is learning how to live with pain, which is decentralizing the role of pain in your life, learning how to eliminate a lot of that distress that's caused so that you can bring back those things that give you meaning, right? Learning how to improve your activity patterns, even though a pain condition is present. Learning what's that fine line between doing too much and too little, knowing that if you go to either one of those extremes, you're going to pay for it. So how do you find that fine line and maintain it? Learning how to address the emotional distress. It's perfectly normal to have those human reactions, but how do we make sure that those things don't persist over time and start to control us? How do we address the sleep disturbances? You know, sleep is so critically important. How do we make sure that we're getting adequate rest so that our bodies are able to replenish the resources that get expended over the course of the day? Minimizing the doctor visits so that we have space for the things that give us meaning in life, making sure that those relationships aren't compromised, and engaging in regular activity so we can avoid that deconditioning. All of you, to a certain extent, have learned how to accomplish this. And in doing so, you've successfully decentralized the role of pain in your life so that you can continue to have meaning. And that's precisely what we mean when we talk about learning to live with pain. But this isn't a step that you get to. It's not a line that you cross that, okay, I've learned how to live with pain now. I'm done with this process. It's dynamic in nature. There's some days that are better than others, some months that are better than others, some years that are better than others. There's some periods of time where your life looks like this square that's depicted on the screen right now, where you're doing really well. You have space for all these things that give you meaning, but then there are other times where it may look like this again, right? And that's perfectly okay. That's part of that dynamic nature of living with pain. But the goal is to be able to have the tools in place to get back to this particular space and to strive to get back into that space, right? So once you've gotten to this place, and many of you have, one of the cruel twists of fate that's happened within our lives in recent times is all of a sudden we had this virus that came about in the year 2020. COVID-19 came about. And despite your best efforts to try and decentralize the role of pain in your life and keep all these things in balance, there's now this virus that you have no control over that has now taken its role and overshadowed all these things that give you meaning, where you're still trying to do your best to decentralize the role of pain in your life, but it becomes difficult to do the things that give you meaning, or it's not possible to do those things because of the presence of this virus, right? Now, early on, when the virus came about, you know, first evidence of some of the virus in the US early last year, but as we started to see that, you know what, we may have to have some shelter in place, we may need to have some lockdowns, minimize activity in public spaces. At the very beginning, we thought, you know what, okay, this is going to pass quickly, right? This is going to be something that we just need to do for a few weeks. Maybe we need to do it for a month, but it's going to be fine. We'll get back to life as normal. And then we can get back to this place where I've got my pain optimally managed, right? But as time passed on, as those days turned to weeks, and as those weeks turned into a month, and that month turned into another month, what we realized is that, you know what? This is a long road. This road seems to go on and on and on. And there's not really necessarily a clear end in sight. We know that there's an end in sight, but it may not pass as quickly as we want it to, right? And so this is that situation that we've all found ourselves in, where we're in this situation where we know that there will be an end, but not necessarily something that's in our control. So what are some of the things that have impacted how we deal with this road that doesn't have a clear end in sight? We know it has an end, but that's not something that's in our immediate foreseeable future or something that's on our immediate radar over these last few months. What are some of the things that have influenced this? Well, we know that the media has affected our response to the pandemic. For one thing, there's so much information that's out there, right? You go to your different news channels, you go to your local news channels, you go to your cable news channels, you get on Twitter, you get on YouTube and watch videos from different people who declare themselves as specialists. or experts rather. And there's so much information out there that it's difficult to know who should I believe, who should I not believe, right? And especially when they're people that are trusted resources, people who you believe to be trustworthy, who are advocating one position versus another, it can be very confusing and overwhelming to know what's accurate. Over the course of time, we can start to have conflict with other people who don't agree. You formulate an opinion of, this is what I think is happening, and this is what I base it on, based on my own research and what I've seen that the experts that I trust have said. But then you have somebody close to you. Maybe it's an extended family member, maybe it's somebody living in your own household who vehemently disagrees with what you say. And so that starts to create a lot of conflict. And then we have distressing news. We hear every day, we had been hearing every day, certainly last year, about the death toll. We heard about the number of people that were getting infected, and it seemed like there was no end in sight. We would see the graphs with these numbers that just continued to rise at these crazy levels. We would hear about what the COVID death is like, how people are in the ICUs and they're dying deaths by themselves. Family members can't be around them. We would hear about how the death itself could sometimes be very gruesome, where people are gasping for breath. And that's certainly very distressing to think about that this is out there, and it can trigger a lot of anxiety. Well, what do I do about this? I don't want that to happen to myself or anybody that I love. And then this coverage was pervasive. You couldn't get away from it. Anywhere that you go, anywhere you see, there's some information about it. Or if you tried to talk to a friend to get a reprieve, people would talk about it. Your friends would talk about it, where it's just all over the place, right? So this is something that influenced how we respond to it, because all of this media coverage, all of the pervasiveness of COVID in our society became a significant stressor, right? But add to that some of the other pieces. We had the lockdowns, right? The orders for us to stay at home. And those things were done with the intention of trying to prevent the spread, trying to do this based on the scientific knowledge that was available. Keep in mind that this is a very new thing to have something like this happen in this day and age in this country. So, operating from the best science that people had, the orders were for us to stay at home, right? And so, while all of us may appreciate, different people have different perspectives on these lockdowns, but they were there for their purpose. But despite the fact that those intentions were good, there were a lot of unintentional consequences with these lockdowns, right? There were a lot of maintenance therapies that were a part of your lives that you used to help manage your pain, to help decentralize role of pain in your life, that you could no longer do, right? Your regular trips to the gym that kept you in basic cardiovascular shape, the parts that you did to keep you from having deconditioning of your muscles. Well, you can't go to the gym anymore, right? The walk that you used to take with your neighborhood girlfriends, you can't do that anymore because you're not in your bubble, and we don't want to have that spread. So you can't do that. Other maintenance therapies that we would do, if you do acupuncture, if you go see a chiropractor, things along those lines, not able to do those. Even basic medical care. There's a period of time where a lot of different clinics were in limbo. They didn't know if they could be open, not be open. A lot of places shut down, or even having just a regular routine follow-up visit was something that you weren't able to do. And so many people had difficulties with obtaining their prescriptions. And as that part of their care got out of line, aspects of their ability to manage their pain became a little bit off kilter. Even some of our most basic fundamental needs, let's take pain management off the table. Just our simple needs, like getting groceries, getting food to eat. When the milk spoils, having fresh milk in the house, some of these things became compromised. Is it safe to go to the store? Am I allowed to go to the store? How am I supposed to get these things? I'm too afraid to do it. I'm not proficient with doing online ordering of groceries, and I don't know if I trust somebody else to pick something up for me and come to my house. So these things became stressful. And then, of course, the impact of not being able to see people. I think that this is one of the things that surprised many, many people, that we, for a lot of folks, didn't realize just how social creature we are, right? That not being able to have that human interaction, for people not being able to go into work, not being able to go into the bank, go into the grocery store and have that regular human action, started to create this sense of isolation. And people started to become more depressed, more lonely. So all of these things, and then some, had a lot of implications. And it hit us like a meteor. It wasn't just a small thing that, okay, well, there's a gradual impact, but this hit us very rapidly. And very quickly, we could see that we start to become deconditioned as we're not able to do our maintenance therapies. Our sleep could start to become adversely impacted, where it's either the anxiety of this COVID-19 pandemic, or anxiety about what are you going to learn about in the news, or is a family member or a loved one going to get affected by this? All those different types of things can start to weigh heavily on the brain, where sleep can start to become affected. We can start to have interpersonal conflicts with the people around us because we don't agree on some of these different safety measures that are in place. And all of this different stress can result in increased pain, right? And we're going to spend a little bit of time later talking about what some of that specific mechanism is. Why is it that stress makes pain worse? But I know that even if you don't understand the mechanism, all of you have experienced that before, that stress can make your pain worse. Oftentimes as this happens, once you're able to go back to the doctor or have video visits, you start to have more doctor office visits. Even though if that was something that you hadn't been doing in a while, you may see an uptick in the frequency that you're seeing the doctor because you're not sleeping well, because you have increased pain. And all of that can result in affective distress. You may start feeling more anxious. You may start feeling more depressed. You may start feeling more frustrated, angry. And if you look at these implications of COVID, this looks very similar to what happens when we first start having that pain that's not optimally managed, right? Where it starts to overshadow all the different aspects of our life. We're not able to have that high level of functioning, where we're not able to decentralize and keep our functioning in the space that we want it to. So what becomes our goal in living with pain in the midst of COVID? Well, our goal becomes very similar to what our goal is when we're living with just pain, but the goal is to decentralize the role of not just pain and get back to that place where pain is optimally managed, but decentralize the role of the pandemic itself, right? And there's actually a lot of parallels. You don't have absolute control over your pain, right? This isn't something that you can flip a switch and make it go away. In much the same way, we don't have absolute control over this pandemic. And so learning how to manage the impact of the pandemic involves a very similar set of tools that we use to try to help manage pain. And those are some of the things that we're going to talk about today, of how we adapt some of those different tools for pain management to living with COVID. So first, we had talked about COVID as being something that's wrought with stress, right? And certainly with this pandemic, this isn't something that's, okay, it's a little bit stressful or moderate stressful. I think everybody here would agree that this last year has put us all in a period of maximal stress, right? Because what's interesting is, in addition to the pandemic and all the impacts that it has, life continues to happen, right? So all of the regular life stressors continue to occur. Our regular health challenges that we still have those health challenges even outside of pain. Our family stresses, the family health issues, all those different things continue to persist. But now what's been superimposed on top of that is this pandemic. And so it just magnifies our stress level. Right? But how does that influence pain? Why is it that stress influences pain? Well, to understand this, we have to understand a little bit about basic sensation and perception within the body. So all of us are wired pretty much the same. The brain is always on, and the brain is always processing information around us. One of the things that the brain is responsible for is detecting the presence of threats or stresses in the environment. Whenever the brain detects the presence of a threat or a stress, it activates a part of your nervous system called the sympathetic nervous system. When your sympathetic nervous system gets activated, there's a whole host of changes that happen in the body. Heart rate increases, blood pressure increases, blood vessels constrict, muscle tension increases, digestive processes slow down, breathing patterns change, a stress hormone called cortisol gets released in the body. All of these changes happen instantly. We don't do anything to make it happen. It's all regulated by the brain. As soon as the brain detects that a stress or a threat is no longer present, it activates another part of the nervous system called the parasympathetic, which brings the body right back down to its previous baseline. Now, all of you have felt this before. Think about if you're driving a car in traffic and somebody cuts you off. All of a sudden, you tighten your grip on the wheel, you sit up straight, you hold your breath, you feel your heart beating a million miles a minute. What that is the sympathetic nervous system activating you in the face of stress. But eventually, as you realize you're a safe distance from that car in front of you, eventually the body comes back down, which is the parasympathetic, returning you back to normal. Now, you didn't do anything in this situation to create these changes in your body. It was all regulated by your brain as it detected the presence or absence of a stress. Now, you might remember this from back in high school biology. It's being called the fight or flight response in the body, right? And this is there in all of us. All of us have this response. You, me, Tom does, Penny does. We're all wired this way. It's just a part of being human. Even our pets have this fight or flight response. But the thing is when they teach us about this fight or flight response, they always talk about it in terms of a life-threatening stressor causing these changes. But the reality is to the brain, at first pass, stress is something binary, meaning something is either stressful or it's not stressful. And anytime the brain identifies something as being stressful, it's going to trigger some of that nervous system reactivity. Now, the magnitude of that nervous system response does vary based on the nature of the stress. But again, at first pass, we're going to have some degree of that nervous system reactivity. So that means whether it's something potentially life-threatening, like a car cutting you off in traffic, or if it's something that's more emotionally stressful, like anxiety when you turn on the news and you learn more things about COVID, or if it's something like a flare in your pain or not getting a good night's sleep. Even though we all might see these as being qualitatively different from one another, to the brain, they're all stress. So they're all going to cause activation of the body's nervous system. Now, this is important in the context of pain because several aspects of that nervous system activation can actually worsen the pain that you have. I'm going to focus in on just one part of that, specifically tightening of the muscles. Think about the areas in your body where you have pain, right? If the muscles are tighter than they need to be, what do you think the impact is going to be on that place where you have pain, right? If you've got pain throughout your low back, if you've got disc issues, or you've got pain on the nerve that's coming out of the spine, and the muscles are tighter, it makes sense that that's going to amplify that pain. If you've got a myofascial pain condition and the muscles are tighter, it makes sense that that pain's going to get worse. Fibromyalgia, joint pain, any of our pain conditions can be made worse. If we have headaches and the muscles in our neck, shoulder, head, jaw are tighter, then that can either bring about a headache or it can lower the threshold to push us into a headache state. So all of these things, this stress response in the body can actually worsen physical pain. But especially in the time of this type of a pandemic, it's also important to note because it can also affect our immune functioning. We know that short bursts of cortisol can actually boost our immunity. But when we have chronic stress or chronic hyperarousal of the body's nervous system, that can actually lower our immunity. So there's a big responsibility on us to try to make sure that we're managing stress as best as possible. So how do we do this? Well, there's a couple of things that we're going to talk about today to try to help facilitate that process. One thing is to regulate our breathing. Now, I'm quite confident that almost everybody who's on this line right now, on this Zoom meeting right now, has had exposure to breathing exercises at some point in time. But what we actually do when we're engaged in breathing exercises is triggering nervous system reactivity in the body, right? So there's three fundamental steps to breathing exercises. The first is we want to make sure that we're breathing deeply, right? And so when we breathe in, basically what happens is we're bringing air into our lungs, right? The air doesn't go anywhere else. It's only going into our lungs. But as our lungs expand, as you can see here in this diagram, as our lungs expand, they push down on a dome-shaped membrane beneath the lungs called the diaphragm. And as it pushes down on there, the diaphragm contracts. As the diaphragm contracts, we actually see our bellies rise. As we exhale, our lungs deflate, for lack of a better word. And as that happens, the diaphragm expands again. And then we see our belly drop. So when we see the rise and fall of our belly, when we're doing this deep breathing, it's not because air is going in our GI system. The air is only going into our lungs, but it's because we're causing the lungs to expand completely, causing the diaphragm to expand and contract, which we see as our belly rising and falling, right? And this is the type of deep breath that we want to take to try to start the relaxation process within the body. We don't want to see movement in our shoulders and in our chest because that's going to be a more shallow breath. That's only breathing in the upper registers of the lungs right here, meaning we're not taking as deep a breath. We really want to see more movement in the belly. But we don't want the belly to be moving because we're using our abdominal muscles to make that move in and out. The belly is moving again just because it's the diaphragm that's expanding and contracting. And the diaphragm is moving because the lungs are moving. So the thing that you want to focus on is just your lungs. Let me take as deep a breath in as possible, and just look down and see, is my belly rising and falling as I do that? But the second step in the breathing exercises is we need the breath to be slow. One way that we can do this is by inhaling through our nose and exhaling through our mouth. We get less volume of air through our nostrils than through an open mouth, and that helps to slow the breathing down. I also usually recommend that people use a counting system when they're breathing. So inhale to a count of 5, pause for a second, exhale to a count of 5, pause for another second before taking another breath. Now, this should feel very wave-like. It shouldn't feel jagged. It shouldn't feel like I inhale, I wait, I exhale, I wait. Rather, it should feel like I inhale for 5 seconds. I feel like I can't get any more breath in. There's a natural pause. I exhale for 5 seconds. Feel like I can't get any more breath out. There's a natural pause before we start that cycle over again. So it should feel very wave-like, very rhythmic, right? Now, what's nice is that as we breathe deep, that helps us slow our breathing down. But as we slow our breathing, that helps make it more deep. So these two things work hand in hand with each other. But the last component that we need for the breathing exercises to work is we need to control where our mind goes. Without this, the breathing exercises aren't going to be effective, right? Let's say, for example, you're laying in bed at night and you're really stressed out about something that you saw in the news about the pandemic, and you keep replaying that in your mind, and you think, okay, you know what? I'm going to try to do those breathing exercises that I learned about before. And so you try to do it deeply, you try to do it slowly, but then your brain keeps thinking about that news report. Well, remember, to the brain, stress is stress. So just those thought processes are going to activate the body's nervous system. And so while you're doing breathing exercises to try to quiet your body, the brain and your thoughts are reactivating you. So the net effect is going to be 0, right? Where you're not going to accomplish what you're trying to do. But even worse, you'll walk away from it saying, I tried breathing and it doesn't work. When it's not that it didn't work, it was that this last component of managing our thoughts wasn't optimized. And admittedly, that's the hardest part of this, right? All of these steps are easier said than done, right? It's easy for me to present the slide and show this to you all and say, oh, do it deeply, do it slowly, manage your thoughts. It's much harder to do than to say. But the deep and slow part, with enough practice, you're able to get that relatively quickly. I would say maybe in a matter of days or weeks, you could probably start to refine your ability to do that. But gaining control over your thoughts on a consistent basis, I've been practicing breathing exercises for 20 years. And I wouldn't say that I can do that on a consistent basis, right? It's still a work in progress because the brain tends to want to go back to those stressful places. And so it's a constant tug of war, but we want it to be a gentle tug of war. We don't want to yank our brain back because that's going to create more stress in the system. But just noticing and acknowledging, I'm going back to that stressful place. Let me try to focus on my breathing, or let me try to focus on a positive image. But with breathing exercises, this is something that sometimes people think that breathing exercises is just a weird West Coast soft mumbo jumbo psychological thing, but it actually isn't. There's science behind it. What we're actually doing, and I guess if I'm saying soft West Coast mumbo jumbo, I probably shouldn't put a picture of a guy with a rainbow coming out of his mouth. But the reality is what we're actually doing when we do breathing exercises is we're triggering something very physiologic in the body. We're actually triggering that sympathetic, parasympathetic nervous system axis that we were talking about earlier. As you regulate your breathing, as you control the thoughts, that sends a signal to your brain that there's not a stress present. And that tells the brain to activate the parasympathetic nervous system, which brings the body right back, starts to bring the body back down to a calmer state. So if you will, it's essentially like a relay race where you've got the baton, you start it, and then you hand the baton to your brain. And the brain continues by relaxing the other parts of the system. It lowers the heart rate. It lowers the blood pressure. It relaxes the muscles. It stops the release of the cortisol. But you're triggering this with the breathing exercises. And so this is one of the reasons why breathing exercises works, is because of what we're doing physiologically in the body. But this is one tool that we can use as we deal with the stress of the pandemic, especially in the heat of the moment, when we catch ourselves just overwhelmed and we feel ourselves getting very tight and tense. But when we have more time to reflect, something else that we can do is we can start to look at the role of our thought processes, look at the role of our cognitions. Now, as human beings, we act as if we're simple creatures. We act as if we're stimulus response creatures. Something happens and I had a response, right? This situation happened and this is why I felt the way I felt. This is why I behaved the way I behaved. And this is why I had the physiologic response that I had, right? And there's a simple example that I like to give to illustrate this, right? Let's say that we have two people, Amy and Haley. Let's say that they're both CEOs of large corporations. They've got millions upon millions of dollars, right? They've got more money than they know what to do with. Well, let's say that it's the holidays, and each of them has an employee who gives them a lottery ticket just as a small token for the holidays. You know, here you go, happy holidays. Well, it just so happens that they were each given the exact same numbers, and those were the winning numbers for the lottery that particular week, and those are the only tickets that had those numbers that particular week. And since we're talking about coincidences, it just so happened to be the largest jackpot in California state lottery history, right? So now all of a sudden, Amy and Haley, these CEOs of large corporations, they've each just won the lottery, right? This is a situation they find themselves in. Amy thinks to herself, this is the holidays. This is great. I can help so many people that are less fortunate than myself. I'm so lucky that I'm privileged enough that I can donate 100% of this money to charity, right? I'm so fortunate. Life is good, right? If this is what's happening for Amy, then probably from an emotional perspective, she'll probably be happy, right? Behaviorally, she'll probably be smiling. She'll probably be very approachable. From a physiologic perspective, once the initial excitement of winning the lottery has gone away, her overall sympathetic nervous system reactivity will be lower, right? Her muscle tension will be lower. Heart rate, blood pressure in a lower baseline state. Blood vessels nice and expanded. And again, her overall sympathetic nervous system reactivity will be lower. And that means that if she has a pain condition, her pain's going to be more at its baseline. We've got Haley, who's also got the same situation. She's also a CEO of a large corporation. She's also won the lottery. But Haley's thinking to herself, this is terrible. I went to the lottery commission in Sacramento. I showed them the ticket and they said, well, congratulations, you've officially claimed it. And now I've got to try to find a tax shelter for all this money before the year is over. You know, this is a story of my life. Nothing goes my way. I should fire that stupid employee who gave me this ticket. Well, if that's what's going on for Haley, she's probably going to be emotionally angry, right? Behaviorally, she'll probably be scowling. She'll probably be irritable. Physiologically, her nervous system reactivity is going to be higher, right? Her muscles are going to be tighter, blood pressure higher, blood vessels more constricted. So her nervous system reactivity is going to be higher. And if she has a pain condition, her pain may be worse because of this stress, right? So let's say that we decide to go for a walk, or all of us are going on a long group walk. We're walking through the streets of downtown Sacramento, and we run into Amy. Amy's smiling from ear to ear. We say, goodness, Amy, you look like you're on cloud nine. Why is that? Amy's going to say, well, guys, it's because I won the lottery, right? And we chit chat with her for a little bit, and then we keep on walking. We run into Haley. Haley starts screaming at us. Can't you people watch where you're going? There's so many of you and one of me, and you almost ran over me. My goodness, Haley, what's wrong with you? Why are you in such a crabby mood? Haley's going to say, it's because I won that stupid lottery, right? So now we have two people who've got very similar situations, but they're attributing their consequences of these situations, their consequences of happiness or anger, irritability, all of these things to that situation. Is it really possible that that situation is causing these outcomes, or is it something different, right? And if we look at this, particularly in this model as I've written it, we can see that there actually is a different mechanism here at play, and that's the way that they're interpreting it, right? And so this is the crux of the cognitive behavioral theory. It says that it's not necessarily the situation that determines how we feel emotionally, how we behave, and what happens for us physiologically, but it's how we interpret that situation that influences those different outcomes, right? And this is something I find very empowering because we can't always control the situations we find ourselves in. You know, nobody signed up for chronic pain. None of us asked for this pandemic to come about. These are things that we don't have absolute control over. But by changing how we interpret aspects of those things, that can make all the difference in the world in terms of what our emotional, physical, and behavioral consequences are. Now, this doesn't mean it's mind over matter. This doesn't mean that you change your thoughts and all of a sudden your pain is supposed to not exist or the pandemic's not supposed to exist. Absolutely not. These things are real, but the impact that they have can be modulated based on changing the way that we perceive things. So it's important to recognize that we're not simple stimulus response creatures, but that there's a mediating factor, right? And by making changes in that middle area, we can influence our consequences. So let me walk you through this using an example. You know, let's say that you're in the midst of this pandemic and you get frustrated with the fact that you're not able to do things. You haven't been able to go to the gym. You've become a little bit deconditioned. You've put on a little bit weight. You haven't been eating as well. You haven't been pacing yourself as well. And you overextend yourself doing some activities in the midst of all that's going on right now, right? You wake up in the morning with a significant pain flare after overextending yourself. If you think to yourself, well, the day is lost, right? There's nothing I can do to influence this. And you know, this pandemic has really ruined my life, right? If these are some of the thoughts that populate your mind, then naturally you're going to feel angry. You're going to feel sad. You might feel anxious and frustrated. You might be more irritable and snap at the people around you. But with all of this stress, with the emotional stress, with those thought processes, your body's nervous system reactivity is going to be higher. Muscle tension is going to be higher. And that's going to result in an increase in your pain. And as your pain gets worse, that feeds back into that flare, making that flare worse. Our thoughts become more polarized. As our thoughts become more polarized, the emotions become more significant. The behaviors become more maladaptive, and we get more nervous system reactivity, which worsens the pain. And so we see the evolution of this vicious cycle that keeps feeding on itself, right? Now, can we go back and change that flare occurred? No, we don't have a time machine, so we can't change that we have that flare. We can't turn off our emotions, right? But the place that we can intervene is at the level of the thoughts. Now, this is challenging because our thought processes tend to be automatic. We're not always aware of the thoughts that we have. And so it can be hard to even bring these into our conscious awareness. But also, we tend to have more than just 3 thoughts. I've only listed 3 here because that's as many as I could put in 18-point font and make it legible on this slide. But typically, we have 20, 30, 40 different thoughts when we have a situation. And so becoming aware of these thoughts can become very challenging. But when we do, we need to ask ourselves, is this really accurate and is this helpful? So it's not something as simple as just turn your negative thought into something positive. I actually cringe when I hear people say that because there's so many things in life that we can't just put a positive spin on. But what we know is we tend to have more negative outcomes when our thought processes start to lose their accuracy and when they lose their helpfulness. And if we can't answer yes to both of these questions, then we need to change those thought processes. So these things here, the day is lost, there's nothing I can do, the pandemic ruined my life. Are these accurate? Are these helpful? Well, we can't answer yes to both of these questions, so we have to change these thoughts. So the day is lost. Well, the reality is, I don't know what the day is going to look like, but I'll do my best. So you're not telling yourself, no, it's going to be a great day, but you're also not telling yourself the day is lost. You're being neutral about it. I don't know what it'll look like, but I'll do my best. There's nothing I can do to control this. Well, I've got tools I can use to try to navigate through the day. The pandemic ruined my life. Well, the pandemic has been hard, but there's still things I'm grateful for, right? Again, we're not saying that there's zero accuracy with these things. Of course, the pandemic's taken a toll on us, but it's when we start to lose some of that accuracy, when the thoughts become a bit more exaggerated, that's what leads to some of those negative outcomes. So if we're able to change our thoughts, or we wake up with that flare, but instead of thinking those other thoughts, we think, you know what, I don't know what the day's going to look like, but I'm going to do my best. I have tools to navigate this. This pandemic's been hard, but I have things that I can be grateful for. It doesn't mean that it flips the switch and we're no longer sad or anxious or frustrated. We still have those emotions, but they're less severe. And it opens a door for us to be able to engage in the healthier behaviors that can help us with that management. And then when we do the breathing exercises, because we don't have all those maladaptive thoughts running through the mind, they're more effective at stopping that nervous system reactivity and stopping that vicious cycle of the pain. So we target the thought processes to help change our outcomes. It's not mind over matter. It's not discounting that the pain or the pandemic or these impacts are real, but it's just trying to rein in the thought processes when they start to become more maladaptive. But beyond just looking at our thought processes, there's also an issue that starts to evolve in the pandemic of a loss of control, right? Because this is something that it may not be helpful for us to think about, but it is accurate to recognize that, wow, we've lost some control. But so what do we do when a thought process like that isn't accurate? It is accurate, but it's not helpful. Well, we still need to modify it, but it's important for us to respect this impact of loss of control. When we have that loss of control, it oftentimes leads to a sense of helplessness, anxiety, anger, and frustration. But we can look at control as having really two different categories. There are things that we can't control and things that we can control. And that sounds simplistic, but the reality is it really does come down to just those two categories. And so it's important for us to look at what can we control and what can't we control. So we can't control what other people say or what other people do, but we can control how we react to what they say or do. We can't control the closure of schools and public spaces, but we can find activities to keep our kids or ourselves busy. We can't control the longevity of the pandemic. We can't control the loss of the loved ones that we may have had in the pandemic, but we can maximize our own safety and self-care. We can allow ourselves to grieve those losses and seek support, right? And so it's important to create a log, if you will, of what is in our control and find the aspects that we can try to have some control over within those things so that we can take some power back and not have that sense of helplessness. Right? So what are some action items with that? Well, maximize those things that are in our control. What are the behaviors? What are the thoughts that we can do? Recognize those things that aren't by making a log of those things. Rather than just feeling like these things are surrounding us that are out of our control, identify what they are. But then for those things that you don't have control over, identify specific coping resources you can use to help facilitate living with those things or managing those things so that they don't get to that point where they trigger that hopelessness, helplessness, and depression. In our daily activities, we want to adhere to all precautionary measures to minimize our risk. Limit our media exposure, limit our exposure to the things that trigger more of our anxiety, depression, and frustration. Whether that be media, whether that be family, friends, we want to control those things that are in our control. At the same time, we want to make sure that we stay connected, that as we're keeping our distance for our safety, that we recognize that social distancing or physical distancing doesn't mean social distancing. Making sure that we stay connected with our loved ones, using technology to our advantage, using Zoom, using our telephones. My mom and I, we both had iPhones for many, many years. My mom lives in Texas. I live here in California, but it wasn't until the pandemic that we started using the FaceTime. I have no idea why we never used FaceTime until the pandemic, but now we use it. And we're like, this is great. Why didn't we do this before all these years that we've been living in different states? But use technology to your benefit. There's another thing called 3 Good Things. And this was something that was started by a group, I believe, out of Berkeley, out of looking at things and having gratitude for the positive things we have in our life. So at the end of the day, before you go to bed, identify 3 good things that happened, right? And don't make it a passive, thoughtless exercise like, I woke up, I'm breathing, I'm going to bed, right? Not something like that. Make it something thoughtful. What are 3 things that happened in the day that made you happy or that you're grateful for? Why did those things make you happy and why were you grateful? And the purpose of doing this is it helps us become more aware of the things that drive our happiness. And then we subconsciously start to seek those things out during the day or become more aware of those things during the day. And then we also start to become more aware of those things in the midst of all this chaos going on around us. So that can be a useful exercise to help us to not get stuck with a lot of the difficult stuff that we're seeing around us. We want to look at our positive health behaviors, adhere to a regular diet, Stick to a regular sleep schedule, especially if your regular activities outside the home are no longer present. You still want to try to adhere to a schedule, going to bed at the same time, waking up at the same time. Have some sort of home exercise plan. Even if you're not going to the gym, see if you can, even if it's walking up and down your driveway a certain number of times, or doing laps around your bedroom or your house. Monitor alcohol intake. We've actually unfortunately seen that there's been an uptick in alcohol use in the pandemic, but you want to be cautious about that. And of course, incorporate more relaxation training in the day. The breathing exercises are effective, but they're more effective the more we practice them, so that when we really need them, they can be there for us. But also, the more frequently we do them, the more we start to lower the baseline level of nervous system reactivity we carry in the system. So make that a part of your daily routine. In your living environment itself, especially when we're eating, sleeping, working, doing our Zoom calls, having our doctor appointments in this space, everything can start to flow into each other. So define a space in your home for your medical appointments, for your Zoom meetings, for your work, if you're still working, and have a separation between that and your regular life and your family life. As I mentioned before, stick to a regular schedule. Use our devices, use technology to help you. Use the calendar app on your phone to remind you of when it's time to do breathing exercises or your regular exercises. Check in with your support system on a regular basis. It can be so easy to find a new series on Netflix and just get stuck watching episode after episode, especially because Netflix will automatically start the next one for you, right? But make sure that you take the time to check in with your supports. And then what about our emotions, right? There's a wealth of emotions that we can experience during this time. And you know what? It's okay to not be okay. It's okay to feel sadness, fear, disgust, and anger. A lot of times we shy away from those because we don't like to feel negative emotions, but allow yourself to feel those because that's part of the human experience. We don't want to get stuck with those, but it's okay to feel those. What we don't want to do is get stuck with them, but we don't want to internalize them. So allow yourself to feel them, allow yourself to express them in a healthy manner. And then make sure you do things to maximize your own health. If you need more support, seek out psychotherapy, manage your other health issues. Just because a pandemic's occurring doesn't mean that your other comorbid health issues aren't important. Make sure you take care of those things. And also make sure that you look out for things like domestic violence. This is something that unfortunately we've also seen an uptick of when people are in the same home and there's not a place to escape. If you feel that you're in harm's way or somebody you love is in harm's way, please make sure you do things to maintain your safety. And so with that, I know I went a little bit over the amount of time that I wanted to, but we do have a little bit of time for questions. And if I'm not able to answer all the questions, I also have my email address up there in case we hit upon the start of the hour. But do we have any questions?
Yes, Dr. Prasad, and I thoroughly enjoyed your presentation. Thank you. This is a rather long question. It says, during the pandemic, for some individuals who, because of illness and disability, and were already living in a practical quarantine, relationships with others near and far have been strained because of the focus of many interactions. For the individuals I'm speaking of who are not able to leave their homes much anyway, it is difficult to look forward to more of the same. But the greater challenge is how we can be supportive of others who don't walk in our shoes, while at the same time trying to help them understand that for us, post-pandemic life isn't necessarily something we are looking forward to. This is an imperfect question, but I look forward to hearing your thoughts.
So there's a lot there to unpack and digest. What I would say is, with that, as we're dealing with other people, what happens is any interaction that we have with other people, we have our own thought processes. We have our own reactions to the dynamics that are going on in the relationship. And I'm just going to jump back to one of these slides that I had here, where I would encourage you, as we look at these situations that we find ourselves in with other people, try to plot it out using this, right? If it's a difficult interaction with somebody else, write out that situation. Look at the interpretations that you're having and look at how that impacts the consequences you have. Are there aspects of that interpretation that can be further optimized? If so, how might we do that? We may find that, I've done this before. I've optimized my interpretations and my I'm not thinking inaccurate, unhelpful thought processes. This is just a difficult situation. Well, in that case, where do we go from there? Well, then it's all the self-care activities. Make sure that you give yourself that space to allow yourself to feel the frustration, allow yourself to feel those emotions, recognize that that's a stress, but then make sure that you do the other self-care things to take care of that. Quiet the nervous system reactivity with the breathing exercises, things along those lines. You know, I appreciate that that's also not a perfect response. It's not a way of just, oh, this is how you handle it, here's the perfect way. But it really is kind of amassing these different things, but making sure that in the midst of all this, you don't lose yourself and taking care of yourself in the process.
Great. Thanks, Doc. Patty said, how to handle friends who don't understand our increased vulnerability and resulting isolation during COVID. This can make us feel like an outsider and affect self-esteem. Any suggestions?
Yeah, thank you for the question, Patty. I would say probably the exact same thing that I just mentioned with the previous question from the other attendee, of looking at the situation, trying to look at the thought processes, right? I mean, the impact on our self-esteem, a lot of that are the messages that we tell ourselves, right? And that's the emotional consequence of kind of the depression or sadness that may come. And so looking to see, are we jumping to conclusions? Are we telling ourselves things that may not be accurate or may not be helpful? And sometimes it's not very black and white. It may not necessarily be that we're calling ourselves names, but there could be more nuanced variables in what we're telling ourselves that could stand to be just a little bit modified to help minimize that impact on our self-esteem. But in recognizing ultimately, going back to that piece of what we talked about with control, we can't control other people, but we can control ourselves. So how can we minimize the impact that hurtful things that people say or do have on us? And if these are relationships that are meaningful to us, that are important to us, then can we learn different ways of communicating? And we didn't talk about communication during today's lecture, but there's a wide range of different communication strategies that we can use in equitable relationships to try to tackle some of those different things. But I would say, Patty, not to sound like I'm just repeating myself, but some of the same things I mentioned in the previous discussion.
Thanks, Doc. I've got a question. You know, basically, before the pandemic, we were meeting face-to-face in small groups. Now most of us have gone to Zoom groups. Is there any comparison between the two different groups? Is it better to do a face-to-face group even if you have to take social distancing, or do you get the same benefits from a Zoom group, say?
That's a great question, Tom, and I would say that there's actually been pros and cons to live and the online. What I've noticed for our groups is that by being able to have it online, we can reach more people. We have a lot of people that are in the Sierra foothills that it's just not logistically practical to have them come to our facility once a week for a class, right? But for them to log on, they're able to take advantage of something that they don't have in their community and they wouldn't be able to do. So it's been great in that respect that we can reach more people. But the downside is we don't get to have that human interaction. And one of the things that comes with living with chronic pain is a sense of isolation, that we're alone in this, right? Pain is a very invisible condition. And there's that sense of isolation that nobody really understands what I'm going through. But when we're in a room with other people who are trying to do exactly what we're doing, trying to capture our lives back and learn to live with this condition, even if we're not talking about the pain or that aspect, just being surrounded by that helps to break some of that sense of isolation. And that's something that doesn't fully get captured when it's an image on a computer screen. So I would say that there's been good and bad that's come from that. And I anticipate that depending on what billing and stuff looks like over time, we may end up seeing from a clinical perspective a hybrid where we end up doing a little bit of both over the course of time because we can see those benefits.
Great. Thanks, Doc. I've got one more question. Let's see. Are there opportunities for you to see new patients via Zoom who cannot travel and otherwise cannot see you? I think you just answered that, right?
Yeah, so if folks want to be seen, so I practice at UC Davis, and all the folks that come to our clinic get referred through primary care to our clinic. Usually, because again, we're a full multidisciplinary clinic, so I don't see anybody just individually, just as a psychologist. Everybody's kind of part of the larger clinic. But certainly that's something that we do see new patients in our center. Also I noticed just in the Zoom meeting that there were a number of people that raised their hand, but the way this Zoom is set up, we can't have people speak. And so I don't want people who had questions to feel dismissed or like they didn't have an opportunity to speak. So if you have questions that we weren't able to address because you raised your hand, but we can't enable audio, I put the slide with my email back up here. Please feel free to send me a message and I'll be happy to try to address your question as best as I'm able to.
God bless you, Doc. I really appreciate it. Great presentation. I appreciate your time and thank you so much for doing this. I think we're at the end of our time, so no other questions. I just will say thank you again, and I look forward to working with you some more.
Well, thank you, Tom, very much. Thank you, everybody who logged on. I know that your time is very precious and valuable, and I appreciate you bringing me into your homes for an hour on I think tonight's Wednesday night. All the days run together. But I thank you for bringing me into your home on a Wednesday night. I wish you all the best. Please stay safe and healthy.
Thanks again, Doc. Likewise. Take care. Goodbye, everybody.
Bye-bye, everybody.